Orthopedics, pediatrics, most of the problems are congenital and fractures. So here we have Kohler's disease, AVN of the navicular, recovers well. Blunt's disease, tibia vera, needs corrective osteotomies. Blunt's disease with this beaking of the upper tibia. Congenital accessory little toe over here, have to determine which is the main toe, preserve that. Congenital achondral dystrophy, short stature cause of dwarfism. Congenital achondroplasia of the pelvis, prone to hip dislocation. Accessory navicular. Congenital, this patient's had congenital bilateral talectomy, so for TEV, the talus has been removed both sides. It's a patient with spina bifida. Spina bifida had both taluses excised. Congenital clubfoot TEV, the surgical correction. Diaphyseal achalacious, abnormal development of bone. Ehlers-Danlos syndrome, elastic skin, look at it here, they get bruising, joint mobility, elasticity. Congenital flat feet from tarsal coalition with flat feet, rule out whether it's painful, whether it's weak, and whether it's stiff. If it's weak, could be muscular dystrophy. If it's stiff, could be tarsal coalition. If it's painful, accessory navicular. Flat feet, tarsal coalition from behind, examine from behind. Congenital flat foot, painful, accessory navicular, painful here. Gigantism, fourth big toe. Congenital hemivertebra, hemi, half developing, causing kyphosis in a 2-year-old. See? Hemi, only partially formed here. Angulates in that area. Congenital left flat foot. Can't get a coin under the medial arch. Congenital macropedia, enlargement of the foot. Mandelung deformity of the wrist, shortening of the ulna, with impingement across here. Navicular cuboid coalition, tarsal coalition. Overriding fifth toe, hard to surgically correct. A talocalcaneal coalition. Trigger finger and the child usually resolves, sometimes operate. Congenital defect of the hand, deformed fingers. Congenital elbow fusion with a fracture. Here's congenital fusion, fracture through there. Cyst in the bone with a pathological fracture. Treat as a fracture and then deal with the cyst later. Salter osteotomy for dysplastic hips. Dislocated radial head. Don't want to miss this. A line along this should go through the capitellum, but here it's anterior to the elbow joint. Don't miss it. Dislocated elbow, posterolateral. Dislocation of the AC joint, acromioclavicular joint. Usually do well in children, no surgery. Carpometatarsal dislocation in a young child. Don't miss it, do a true lateral. Habitual dislocation, the patella is riding over the side, difficult to deal with. Fibrous dysplasia of the femur. Are prone to fractures, common. Fracture of the base of the thumb. Fracture of distal humeral shaft. Is closed reduction, hole with capons. Fracture of distal radius. Huge remodeling potential with these patients, certainly young children. Fracture of the femoral head in the child. Fracture of the neck of femur in the child is a surgical emergency. They often go on to avascular necrosis of the femoral head, much more so than in adults. Fracture of the femur, 2-year-old, you need a little bit of overriding otherwise, because they get stimulated, they get lengthening of the bone from the fracture. So let them override a little bit, but they heal with traction. Fracture of the forearm, look at the remodeling here according to Wolff's law. Bone is laid down under areas of stress, resorbed where there's no stress. So bone is laid down where under areas of stress or loading. Fracture of humeral shaft for 11-year-old. Fracture lateral condyle, easily overmissed, just very subtle, needs surgical fixation. Fracture lowering the humerus, easy to deal with. Markedly displaced fracture tibial physis of the ankle joint, check, they may go on to physeal arrest. Fracture medial malleolus, check these out carefully, CT, need to get to a good position. You fix them in this manner. Fracture medial epicondyle, if it's displaced, needs surgical reduction. This fracture, medium malleolus in a child, will need open reduction, return fixation, high chance will go on to physeal arrest. Fracture mid-clavicle does well in the child. Fracture mid-shaft femur, 4-year-old, non-operative management. Traction, 10-year-old, also non-operative management. Fracture of the pelvis does well in children, huge remodeling potential. So does fractures of proximal humerus, children, huge remodeling potential. Fracture of the radial head, dislocated elbow, need to put it back in position, check it, may require open reduction. Fracture of the radial head in the 4-year-old. Remodeling, but you need to get it back in a good position. Fracture of the forearm, plastic deformation, trampoline, 2-year-old. And again, buckled or plastic deformation. Here's another same injury. Fractures radius ulnar closed reduction. You don't have to get end to end, makes it more stable. Just get good alignment, about within 10 degrees. Sublux radial head. Got to watch these, got to get it back in position. Supracondylar fracture of the humerus needs fixation. Closed reduction to hold with K wires. This is one way of doing it. You can put 2 wires on this side, or one that way and one that way. Closed reduction of the wrist, fracture. Fibrous dysplasia, common in children, can have a fracture through it. Osteogenesis imperfecta, different types, they can fracture soft bone, easily fracture. Treat non-operatively or just treat according to standard fracture principles. Toddlers fractures, young children, lower tibia, huge remodeling potential. Cast, parents get very deformed. Fracture of the ulna, fall on the trampoline. Fracture distal radius, closed reduction, do well. Fracture lower tibial physis, damage to the physeal growing plate. Here's a fractured forearm, looks a little bit angular, but there's remodeling here. See how new bone's been laid down there, resorbed. There is a fracture involving the ankle joint. Again, looking out for physeal damage, reduction, supracondylar fracture, traction, manipulate the fracture, correct the varus, and then hold the reduction with wires. Fracture of the ischial tuberosity in teenagers, they do well non-operatively. Fracture medial epicondyle, if it's markedly displaced, may need to do something. Fracture inferior iliac spine, non-operative management. Fracture of the tibial tubercle may need open reduction, internal fixation. Common fracture lower femur, very prone to physeal arrest. Reduced whole K wires, but could arrest at 12 to 18 months. Delayed union fracture, Jones fracture of the base of 5th metatarsal. Have to follow it carefully. So diaphyseal fracture. French osteotomy, correction of a varus deformity of the humerus, gunstock deformity following a supracondylar fracture. Growth place arrest lower femur after fracture. 3C fracture of the tibia, 10-year-old run over by the car in the steps of a church. End up with amputation. Lisroff frame for osteochondral dystrophy. Very useful technique, Lisroff frame. There's a late fracture of the elbow, late fracture, Montagia. It's a fracture, dislocation of the radial, fracture of the ulna. This is a late one. Look how it's deformed. It's been out for quite a while. Lateral condylar, subtle fractures need open reduction, internal fixation. Here's a fracture involving the physis of the ankle region, 13-year-old. Stopped growing about 16, so there will be growth arrest, but it may not be so critical. There's not many years of remaining growth left. Supracondylar fracture of the humerus, we've spoken about that. Fracture medial epicondyle, this may need to be put back on. Fracture of metaphyseal region, 10-year-olds. So look at remodeling potential, a little angulated, but remodeled perfectly over time of months. Fracture of the femur, held in a box splint. Here's an open fracture with nerve damage, vascular damage, and already a cool foot. Ended up below knee amputation in this manner. Children do well with amputations. Fracture open tib fib in 8-year-old, huge remodeling, closed management. Open reduction mid-shaft femur in a 10-year-old held with minimal fixation. There's a fracture of the lower end of the femur held with K-wires and traction. And here's internal fixation, tibial tubercle fracture. This is the end of part 1.